Today we are going to see about the anatomy of rectus sheath. So let's see about it. What is rectus sheath? It is an aponeurotic sheath enclosing the rectus abdominis muscle along with pyramidalis muscle if it is present on either side of linea alba. So first you should know about what is meant by aponeurosis. Aponeurosis means it is a thin sheath of connective tissue that helps the muscle to go and connect with the bones strongly. Next we will see the derivative of rectus sheath. It is derived from the aponeurosis of flat muscles of anterior abdominal wall. So what are the flat muscles of anterior abdominal wall? External oblique, internal oblique and transverse abdominis. So what are the functions of rectus sheath? So the first function is bowing of the, what is meant by RA means rectus abdominis muscle during contraction, which helps to increase its efficiency. The second function is maintaining the strength of the AAW, that is what is meant by AAW means anterior abdominal wall. So let's see about the features of the rectus sheath. It has two walls, anterior wall and posterior wall. Look at this diagram. The anterior wall here, it is complete and it covers the entire extent of the muscle longitudinally. While look at the posterior wall, it is deficient above and below and it does not cover the entire extent of the muscle longitudinally. Above, it is attached to the costal margin to the 7th, 8th and 9th costal cartilage. Below, there is a line called arcuate line. It is also called as line of Douglas, which is present between the umbilicus and the pubic symphysis. Now let's see the formation of the rectus sheath. There are three levels. So first one is above the level of costal margin. The anterior wall is formed by the aponeurosis of external oblique muscle only, that is only EO. Then posterior wall is formed by 5th, 6th and 7th costal cartilage. Remember that posterior wall is deficient here. The next level is between the costal margin and arcuate line. The anterior wall is formed by the fusion of aponeurosis of external oblique and anterior lamina of aponeurosis of internal oblique muscle, and posterior wall is formed by the transverse abdominis and posterior lamina of aponeurosis of internal oblique. The next one is below the arcuate line. Here the anterior wall is formed by all the aponeurosis of all the three flat muscles and the posterior wall here is deficient. Next we will see the contents. There are two muscles, two arteries, two veins and six nerves. The two muscles are rectus abdominis and pyramidalis if it is present. And the two arteries are superior epigastric and inferior epigastric artery. The veins accompany the artery. So superior epigastric and inferior epigastric vein. The superior epigastric is derived from the internal thoracic artery and inferior epigastric is a branch of external iliac artery. Then there are totally 6 nerves. So what are those? Those are the terminal parts of lower 6 thoracic nerves, that is lower 5 intercostal nerves plus subcostal nerve. These intercostal nerves enter the rectus sheath and emerge as anterior cutaneous nerves.